Let's design the hospital of the future. This is Bertalan Meskó, and you're watching the channel of the Medical Futurist. In healthcare worldwide, prices go up. Medicine is not ready to embrace the new technological solutions. There are huge waiting lists. Patients sometimes lose not only hours but days from work because how hospitals work normally. Let's redesign it. A company called NXT Health has already done some amazing job about designing the future waiting rooms or future patient rooms, how they would be constructed, what they would look like in real life. And I kept on thinking about what other things we could include in the hospital of the future. Let's see some of these. First, a BBC documentary aired in the 1950s featured huge lamps in the operating room. They said that the medical record could get to the doctor sooner than the actual patient. Quite futuristic things, right? Well, we need to be more brave about that. If the hospital of the future will not be our home, it should include a few new elements. No waiting time will harden the lives of patients, as cognitive computers will organize all the details of the healthcare system. It will direct people when and where to go by analyzing their records and automatically responding to doctors' notes and prescriptions. Extrapolating from today's trends, it is clear sophisticated medical robots, surgical robots, will rule the scenes of operating rooms. Although not all operating rooms will include surgical robots, as there will still be operations that could not be performed using only robots. Devices and equipment of radiology, surgery and many other specialties, from CT scans to endoscopic technologies, will be so small they would all fit in the operating room. Cameras will record every movement in the OR, as robots will be controlled from a different, sometimes distant location. Examples are already available. For example, in the Radboud Medical Center in the Netherlands, they already record every movement in the OR with cameras. Using radiology images such as CT or MRI scans, patients and surgeons will be able to look into the body and even organs of patients before the operation for better surgical planning, and during the operation for more precise movements. We could use augmented reality in action, zooming into the patient's body before opening it. The future of hospital will include materials that cannot be infected. Flexible touchscreens featuring important health data will be around the bed, which will be controlled by the patient, being in the center of attention. The walls of the patient room might include virtual reality to make sure the patient feels literally at home by showing them images and pictures from their home, which they can upload to the system while lying in the hospital bed. Waiting rooms will feature charging sets for wearable devices, where data could also be exported before the actual visit, so the physician will get the data they need. So these might be the key elements of the future in hospitals, in waiting rooms and patient rooms, but we need more. We need to keep thinking about how to redesign the whole hospital experience, or we need to bring the care to our homes through new technologies. That's a question of the future, but we need to make sure that healthcare is going to be affordable, quality, and still provide humanistic care to focus on the actual patient. Please share what you think about the future of hospitals and read more about that in my new book, The Guide to the Future of Medicine. Thank you.